Hello, I'm Dr. Mason, and in this video I'm going to show you 4 stretches that you can do to ease sciatic pain during pregnancy. So sciatica during pregnancy is one of the most common problems that women will experience. This is the sciatic nerve right here. You can have it on either side. This picture just shows it on the right side. The blue area is the nerve, and a lot of times it has pressure and it's impinged from muscles and bones in this area, and the pain will go right where that nerve is. So oftentimes the pain is expressed through the hip, through the butt area, down into the calf, into the foot, and symptoms are going to be a sharp pain. It hurts while moving. There'll be a burning sensation a lot of times. If it's bad enough, there'll be numbness and tingling going all the way down into the foot. And so these are some stretches that you can do to help ease this pain at home. So the first one is called the piriformis stretch, and this targets the piriformis muscle, which is the one that's typically in the wrong position, and this is the one that's actually pressing up against the sciatic nerve. So essentially what you do is, in this picture right here, her left leg is higher than her right leg, so she's stretching the piriformis muscle on her left-hand side. So what you do is you grab onto your thigh on the lower side and then pull your knee to your chest, and then that stretches that muscle. But you want to make sure with all of these exercises, you hold each one for 30 seconds, and you also want to make sure that you do them on both sides. So this one right here, she's going to be stretching the left piriformis muscle to help with the left sciatica pain. Second stretch that we do right here is this one is actually called a pigeon pose. And in this case, what she's doing is opening up the muscles and stretching them out. You want to do this again on both sides, but in this case, she has her right leg in front of her left leg. So in this case, she's actually stretching the nerves out on her left side. All right, so again, watch with any knee problems. Oftentimes between these first two poses, these first two stretches, these usually take care of the sciatica right away. But if it's still there, this is the third stretch called the seated hip stretch. Pretty basic, cross one leg over the other leg and then start to create a little bit of torsion within your hips, and that'll start to stretch the muscles and put them in a different position as well. And then the last one, what we call self-trigger point therapy. Essentially what you do is feel the back of your hip, back of your leg, back of your butt area, and if you can push on a tender spot, what you're going to do is put a tennis ball right on that spot. Use your body weight to get in there and dig that muscle adhesion out, and hold this for 30 seconds again, and this works great for sciatica. Okay, so hopefully these 4 stretches have helped you out, and you can do these at home, help to alleviate the sciatica. The last thing I'm going to explain, though, is for the patients that do these stretches and the pain just keeps staying with them, or it seems like it's getting worse as time goes on. And chiropractic care has worked really well for aligning hips and helping with sciatic pain. And specifically the technique that we use for pregnancy, prenatal adjusting is what's called Webster's technique. And so this last diagram I'll show you is essentially a picture that shows 2 different hips, and it shows how one hip would cause pain while the other one doesn't. So when we're looking at these 2 different pictures here, the alignment on the left-hand diagram shows a hip and a pelvis that's aligned perfectly, and so that's going to take pressure off of the 3 ligaments that attach to the uterus. It's going to take pressure off of the piriformis muscle. Right, the second picture, the one on the right, shows a misalignment of the hips, stretching all the muscles, stretching all the ligaments, and then putting pressure on that sciatic nerve. So this is somebody that keeps stretching over and over and over again. The problem keeps getting worse or staying the same. They're not noticing any results with it. This is where chiropractic care is needed, and this is where Webster's adjustments help really well with this. So essentially our goal would be able to take an alignment on a hip and make it look like this first diagram rather than the second diagram. We do that off of feel. We can feel the hips. We test different neurological markers, and they show us if the hip alignment is off, and if it is, our goal is to align the hips, and that helps again, take pressure off of the sciatic nerve. So hopefully you got some great information from this video. If you have any questions, feel free to give me a call. I'm always available for phone consultations. Check out our website also, and have a great day.